Physical therapy is not just for old people like most people assume, but it's actually for everyone. Physical therapists work with movement and improving a patient's quality of life. They work in offices, hospitals, schools, and nursing homes. Whereas physical therapists work to improve movement, occupational therapists work to help patients with everyday activities. Occupational therapists are known to treat physical, mental, and developmental issues.
Outpatient orthopedic physical therapy centers allow patients to receive physical therapy in their own communities, helping with the correction of bone and muscle deformities. They are typically private practices or local clinics. Although outpatient centers focus on similar medical conditions as inpatient centers, these patients' health issues are less medically complex. An example would be a first-time stroke patient with no further medical history. Outpatient clinics are ideal for improving mobility in everyday life, as well as providing other services like pre- or post-surgery rehab, biofeedback, aquatherapy, and much more. Patients tend to go 1 to 4 times a week depending on their recovery and can spend 45 to 60 minutes doing exercises and other things.
PT is not just present in clinic and hospital settings. It's also present in public and private schools. School-based PT is targeted towards students who need physical assistance in the school setting. They aim to create and ensure a physically safe environment for students with disabilities and the staff in the schools. This allows for the students to achieve their education safely and in a form that is accessible to them regardless of their disabilities. For example, when working with children with autism, PTs work to assist their learning by adjusting them in maintaining the balance on and off buses and navigating the playground and physical education classes.
Pediatric physical therapists can focus on younger children who are still growing. Pediatrics can be offered in hospitals or private practice clinics. These PTs assist children, specifically from birth to 18 years old, in making sure their maximum potential to function properly is reached, whether it be from an injury, pre-existing conditions, or problems caused by illness diseases. This can be done after surgery or just to make sure they are learning and developing their motor functions correctly.
After a surgery, it is likely your doctor will require physical therapy. Their goal is to help the patients regain mobility, reduce scar tissue development, and ensure a full recovery on any replacements or repairs post-surgery. In doing so, it is likely your physical therapist will make a plan of activities, exercises, and stretches based on your needs. At times, it is also recommended to speak to a physical therapist before your surgery. This can often help calm the nerves, make you feel more prepared after surgery, and already establish a connection beforehand. Some of the most common types of surgeries to where physical therapy is likely required is knee surgery, elbow surgery, hip surgery, and many more.
Occupational therapists work along physical therapists to treat injured, ill, or disabled patients to develop, recover, and improve the skills needed for daily living, such as brushing your hair or teeth. They may work in a mental health setting, assisting patients that have developmental delays, mental illnesses, or emotional trauma. Activities of daily living may be difficult for someone struggling with mental health, and an occupational therapist can help them cope with and learn or relearn to engage with daily life activities. Occupational therapists may also work in many different fields, from hospitals, working with surgery patients, mental health settings, elderly population, children, and those with permanent disabilities.
Even in the absence of acute injuries or illness, many otherwise healthy individuals can benefit from physical therapy to relieve pain from chronic overuse and to correct improper movement patterns. Some examples of conditions that physical therapists can help with include carpal tunnel syndrome, TMJ, pelvic floor dysfunction, and lower back pain. Along with other treatment modalities, physical therapists teach clients optimal movement patterns in order to move more safely and efficiently, which can help them maintain a better quality of life.